Just checking. Just checking whether you can hear me.
Yes, madam.
Yes.
Okay, thank you. Okay, so good morning to all of you and very warm greetings from Sri Lanka. And so let me welcome all of you to the last of a series of pre-conference webinars that were held over the last 3 or 4 months. And today's webinar, the topic is best practices in establishing online communities of practice. And the speaker is a very good friend of the College of Medical Education is Dr. Diyantha Somantri, and whom I would be, introducing formally later. So thank you very much, everybody, for the enthusiasm shown and registering in advance. So I hope the others would join in time to come. And communities of practice is something very important nowadays. So that really means collaboration to enhance the skills of a group of professionals, maybe, or a group of people with common interests for the benefit of whatever the area that they are serving. With that, may I introduce the speaker for today? She is, sorry, I did not introduce myself. I think I'm President College of Medical Educationists, and I'm Kosala Marambe. So let me introduce the speaker, Diyantha. Dr. Diyantha has graduated from the Faculty of Medicine, University Indonesia in 2005, acquired the Master of Medical Education from University of Dundee in 2007, and PhD in medical education from University of Melbourne in 2013. She is now the head of Master in Medical Education program, University Indonesia, and also responsible for the multi and interprofessional curriculum of health sciences cluster. Since 2018, she is appointed as the Vice Director of Medical Education of the Indonesian Medical Education and Research Institute, IMERI. Her research interests are student assessment, reflection and feedback, interprofessional education, and collaborative practice. So you're one of the, very suitable persons for this session, Diyantha. And thank you very much for accepting our invitation, and over to you.
Thank you very much, Prof. Kosala. Thank you very much for the invitation, for the opportunity for me to share what I understand about community of practice. I will share my screen. I think it's already on. So thank you very much for the kind introduction. A very good morning to all of you, ladies and gentlemen, the participants of this particular webinar. I'm broadcasting live from Jakarta. It is now 1.5 hours ahead of Sri Lanka. So good afternoon here, but a very good morning to you. Yes. Yeah, I hope my screen is already on. Okay,
Yeah.
a very good morning to all of you. Today, I would like to discuss with you the best practices in establishing online community of practice. My presentation for around the next 30 minutes will be about the definition of COP, the elements and the application of COP, and we'll also discuss in more depth the online COP because currently our mode of communication is particularly significantly online. So we're going to discuss what is the online COP, what are the elements of online COP and the application as well. And then we're going to discuss also about how to establish the online COP. And I will close my presentation with several take-home messages. So at first, as a start, I would like to have your opinion on community of practice and also some examples of community of practice which you are or were or have been involved with. So is it possible to go to menti.com? So I will click, I will share the link into the chat room. So if you can go to this website, you click the link that I've provided in the chat room. And then when you are in the Menti, you can type in the following code, 9601200. And then there are 2 questions there. You can answer the questions according to your opinion in the Menti. So I hope you have no problem in accessing that. If you have problem, then we can just skip the Menti and we can just do the discussion through the chat box in the Zoom. So you can go to www.menti.com if you cannot copy paste the link, and then you type in the code 9601200, and there will be 2 questions there. First is, what do you think of community of practice? You can describe it in 1 word. Yes, thank you. Sharing, discussion forum. Yes, the results are coming in. We'll see the word of clouds, the words of cloud just now. We'll just see the words of cloud. Teamwork, sharing, practitioners, discussion forum. E-practice, very interesting. Collaboration to enhance. Thank you. Perhaps other opinions? Okay, maybe we can move on to the next. Oh, yeah, it's still coming in. E-practice, practitioners, sharing. Yes, so I think the main idea so far is about sharing. This is the largest words here in the clouds. So about sharing, team, professional support system, very interesting. So this is about a support system for all of us as professional in our own expertise. Thank you very much. Let's move on to the next question. Please name 1 COP that you are or you were involved with. Anything. It could be professional, but it could also be related to your hobby. Do you have any experience in being in one particular COP that, or you consider it as COP? Maybe it doesn't name as COP, but you think that is a COP for you. For example, related to your hobby, like cooking maybe, or singing club or something like that. Blogs, thank you. HPE group, thank you. Somebody is posting in the chat room. Thank you very much, Dr. Sivan. HPE group, that's an example of COP. Social media professional groups, COVID helpline, very relevant to the current situation. Perhaps any other examples? Research, yes, research COP, very interesting and very useful, I think, to have a COP discussing about research. Maybe I'll give another minute or so because we still have time. Mentoring program, thank you. ASME, yes, ASME is a sample of community of practice. WhatsApp groups, yes, we can have many community of practice which are interacting through WhatsApp groups. Hospital ward team, medical audits. So we can see the various COPs presented here based on your personal experience. Okay, thank you very much. I think I will stop the Menti. We've had quite, hold on. We have, okay, yes. So we've had some of your opinions regarding COP. You've mentioned about COP being as a support system. You mentioned about COP is about sharing, about collaboration to enhance practice and so forth. And you have also mentioned very good examples of COP, such as in the hospital ward, in the HPE, the health professions education, and through the WhatsApp groups, through many different modes of communication. Thank you very much, ladies and gentlemen. So let's see now what is COP. So if we look at the definition of COP, COP is defined as a persistent, sustaining social network of individuals who share and develop an overlapping knowledge base, set of beliefs, values, history, and experience, focused on a common practice and or mutual enterprise. So if we look at the your opinion about COP is very much relevant to the definition provided here, in which there are network members or network of individuals who share the knowledge, who share knowledge and understanding, beliefs and values to enhance practice. So basically, the purpose of COP is to improve or enhance practice of professionals involved in the COP. So there are several concepts of COP which I consider is to be important for us to discuss. First is that COP is grounded in the reality of practice. So if we discuss COP, we really discuss about the reality of practice. So we understand that learning is not only in the class or in the formal education, but we can learn a lot from our practice, be as a medical practitioner or as a health professions teacher or medical teacher and so forth. So with the reality of practice we encounter day by day, community of practice helps us to learn from all the practices on all the experience. Because COP connects people through formal and informal interaction in which all the members of the COP will develop a shared identity. If you are in the HPE group community of practice, you will have a formal and informal interactions and you will develop a shared identity as a health professions education teachers. And COP is also important to support motivated teachers. So if we talk about COP in particular in health professions education, COP is very important to motivate teachers further. We have faculty development program, for example, formal training, formal education to equip teachers with skills and knowledge to teach, but COP is very important to support them further. And COP is sustainable because it is based on relevant needs-based activities. Because it is grounded in reality of practice, that's why it becomes very relevant, because COP is developed and established based on the certain needs that have been identified by the group. Basically, COP can be divided into two types: spontaneously created COP and intentionally developed COP. I think the name speaks for itself. Spontaneously created COP is COP which is spontaneously developed. For example, among scholars in medical education to foster medical education research, among basic science teachers to apply new teaching methods, and among physicians in skills laboratory to create simulation models. So nobody asked them to create COP, but they perhaps have similar experience. They involved in something similar. So that's why they be in a group and then they create COP to help them achieve a common goal amongst all the members. Whereas intentionally developed COP is a COP that is intentionally developed, as the name speaks for itself. For example, as a part of a faculty development program in a school, the school or the head of the school can create a COP to help teachers within the faculty to improve their skills. So it is an intentionally developed COP. For example, the one that I will discuss later, the virtual COP for family physicians. I like this figure so much because it really summarizes what is COP, where a number of people come together, where they have common theme, a common purpose, and they build trust among members in order to share tacit knowledge and develop shared practices, and then they create collective intelligence. At the end, they will have knowledge that they can apply further in their practice. So it's really summarize what is COP. So let's move on to the elements of COP. What are the elements of COP? First is domain. So when we want to identify what is COP and what is not COP, we can look at the elements of COP, whether that group has these particular elements of COP. First is the domain. The domain is the area of knowledge that brings the community together, gives it its identity, and defines the key issue that members need to address. So basically, it's the group identity. It's what differentiate or distinguish this community from other community. For example, the HPE group, that's the domain. The domain is the identity. The identity of that group is that this is the group for the health professions educators, or perhaps for the medicine is also a COP, and the domain is the medical practice. That's what identified this particular COP. The next element is the community, which is the group of people for whom the domain is relevant, the quality of the relationships among members, and the definition of the boundary between the inside and the outside. So we have the domain, but of course we have to have the members of the community. So this is the second element, the group of people involved in the COP and where they interact. So it's not only important to have people within our community of practice, but also interaction between all the members. To share, to share knowledge, to create practice in order for them to achieve the common goal or the common purpose. That brings us to the next element, which is practice, which is the body of knowledge, methods, tools, stories, cases, documents, and whatever, and many other, which members share and develop together to address recurring problems in their specific context. So this is where, when the individuals within the COP have interacted, have discussed, then they will create something, new knowledge, new ideas, new tools for teaching, for example, new documents to support them in teaching and so forth. And this will then can be applied into their specific context. So if we as HPE group HPE COP, perhaps we then create a certain approach to teach students in the online setting during this pandemic. And that approach will be applied in our own setting as an HPE teacher. So that's the third element of community of practice. So if we ask what is the difference between COP and our other WhatsApp group, for example, we have to look at these elements, whether they are domains, community, and practice. And if these three elements occur, then we can safely say that that's a COP. But apparently, there's not the only one that's important. Aside from the three elements, we see that there are a number of attributes defining as community of practice. For the first is the participation and the reification, in which members of the community should interact, should work on something, should discuss something. They cannot be a member who just listen to one person saying them to do things. So it's not about one senior who will tell the juniors what to do. That's not community of practice because there's no participation. But the good community of practice then will involve interaction amongst all the members, including the seniors and the junior members. And after the participation, there will be reification, where the community of practice will produce artifacts, theories, concepts, documents, and so forth. So Wenger emphasized that learning in a COP requires both participation and reification to be present and in interplay. So all the members of the COP needs to interact with each other, share knowledge, ask questions, discuss, and then maybe argue about something. And then at the end, they will produce certain values, certain practice, certain knowledge, and so forth. In order to achieve that common goal, there needs to be joint enterprise where there is collective understanding of what the community is about or its purpose. So everyone in the COP will have to understand what they want to achieve from the COP and why the COP is necessary. And there should be mutual engagement where everybody interact. And of course, there will be norms and expectations and trusting relationship. If we have HPE COP and we do that through the WhatsApp group, for example, through online, there will be norms of what can you say, what can you post in the group, and so forth. So that is to make the COP more effective and be able to achieve the purpose. And of course, there's shared repertoire where we use resources together, whether that's methods, standards, and documents, and so forth. So these are the attributes of community of practice. And of course, we have to have engagement, imagination, and alignment. So in engagement, you have to do things together. We have to do things together. We have to produce artifacts. We have to produce knowledge. We have to produce understanding through the discussion and sharing that occurred in the community of practice. And we have to have imagination in which we reflect and constructing an image of the practice and its members and seeing self as one of them. So it's basically the application of what we've learned in the COP into our own setting in our own context. And of course, alignment is also very important, where we follow direction and align ourselves with the expectation and standards in the community of practice to achieve the common goal. Let's look at the applications of COP. If we were asked what is the example of COP, we can safely say that medicine is an example of COP. Medicine is a community of practice, as detailedly elaborated in this article, where members, new members of the community, new graduates of doctors, for example, they will join the community as doctors, but they're still what is called the legitimate peripheral participation. So they're still in the periphery of the community. And then, but they are the legitimate member because they already graduated as doctor. And in time where they involve in the community of practice, they involve in the practice, they share information, they learn about each other, they learn about what is the medical profession, what are the norms in the medical profession, and they can see the role models, their seniors working and so forth. At the end, they will join the community as a full member. So from the legitimate peripheral participation, they will become full participation in the medicine as a community of practice. And the concept of community of practice here is very much related to the professional identity formation. So when graduated as doctors, yes, they have been graduated as doctor, but whether the professional identity has been fully developed or not, we might not know about it. But when they join the community of practice, become the peripheral member of the community, they will then develop and establish the professional identity based on what they see from their role models, based on their experience with other colleagues, and also based on their experience with the patients. So in the medicine as a community of practice, engagement and participation are very important, because we understand that learning is a social activity. So becoming doctors or immersing ourselves into the medical practice, of course, require learning, reading, and individual learning activity, but it's not enough, because learning from others, learning in a social community is also is a learning activity. So because we understand that learning is a social activity, then community of practice is very important to support our learning. And within the community of practice, we will share formal and informal knowledge and our explicit and tacit knowledge. So this is the application of COP. Medicine, who are very near to us, is also a community of practice. Another application of COP is a part of the faculty development program. This figure from Steinert is very relevant when we talk about community of practice as a part of a faculty development program. Usually medical schools, we have numerous programs to train teachers, to equip teachers with knowledge and skills to teach. But actually, what is also important, but sometimes perhaps left behind, is the importance of communities of practice and work-based learning. So perhaps it is very important for medical schools to establish COP as a part of the faculty development program. And we have to ensure that teachers value and find the community. They can find the community, they can develop the community and they value the community and learn from the community and then apply it into their practice. And this notion is very aligned with with the reality that we learn from everyday experience. Everyday experience, our learning experience. And it is always good if we can reflect on the experience together with our colleagues in the COP. So if we talk about COP as a part of a faculty development program, it's also important to talk about the recognition or the rewards that the faculty or the school give to the community of practice, whether they can value teachers who immerse themselves into the community and learn from the community. So that will be one challenge that we will discuss later. But this slide wish to highlight the importance of communities of practice as a part of the formal faculty development program in our university and our school. So if we look at the types of COP, the COP in faculty development program can be categorized as intentionally created COP as a part of a faculty development program. So if I would like to highlight specifically for COP in the faculty as a part of faculty development program, because I think it's very relevant for us to not only do formal faculty development, but also look at the potential of the COP. First of course, we gather a core group to launch the process. We articulate the goals and values of the COP. So there should be specific goals of the COP as a part of the faculty development program. We start with a specific task or project and make it problem-oriented. So for example, in the current situation in the pandemic, last year we were struck with this situation, and then there some groups will gather then to discuss how can we optimize learning in the online setting. So that could be the specific task or project that will be encountered and will be delved by the community of practice. We keep the COP open, so it means that we can invite people to come in, so we don't make it exclusive, but we are inclusive to invite as many as possible members of the faculty to join the COP. We intentionally invite members with expertise and fresh ideas. So it is interesting when I read about COP, the role of facilitator, the role of mentor, the role of expert in the COP is very important. So we cannot have a COP with members with the same expertise or the similar stage of expertise or similar level of expertise. So it is said that it is good in the COP if you have diverse level of expertise. So it is okay for us to intentionally invite members with expertise, maybe somebody who's senior and more experienced and have more expert to join our COP, to perhaps pass on some knowledge, some expertise in the COP. So it is okay. So it is said to be better anyway when the COP consists of many people with different level of expertise. In that way, that the learning process will occur in the COP. Choose a facilitator. Facilitator is very important to guide the process, to initiate the process, to involve everyone, to contribute and to discuss and share in the COP. Make it worthwhile for the members and for the institution. This is, I think, what relates to the reward and recognition. When we reward teachers to attend a formal faculty development program, can we reward teachers when they are active in their community of practice, when they contribute to the COP and share something in the COP? Maybe that's something that we need to discuss and think about, because I'm not sure that it's there, this recognition or the reward system, but we have already reward system for the faculty who attend and join a formal faculty development program. But how can we reward or recognize the participation of faculty in the COP? That's perhaps something that needs to be studied further. We have to work to ensure institutional support. So whatever the type of COP, we have to ensure that our institution support and give the logistics. Perhaps we have online COP in terms of technological support. Maybe the institution can support us. Go online. So this is already the tip for implementing COP for faculty development. Go online. We will discuss this further. And of course, promote sustainability, communicate success, and evaluate the COP. Whatever we do, we have to evaluate. And when we have some success, we can communicate this success to propagate more and more COP to be created and to be developed in our institution. So that's the first part of my presentation. Then I will move on to the more specific discussion about online COP. What is online COP and what are the differences? Basically, the elements, the definition is the same, but of course, the online COP means that the process of COP is facilitated by technologically mediated communication. So basically, online COP is a group of people who share and develop knowledge, beliefs, values, and experience, focus on common practice through regular interaction facilitated by technologically mediated communication. So for example, we HPE group from all over the world, we meet in the WhatsApp group or in the another discussion forum where we can share ideas and knowledge, and that's the online COP of HPE group. So what are the elements? The elements is basically the same. One article from Su and all 2001, quite new in the higher education, not medical and health professions education, but higher education, through for around about teacher professional learning, where they built an online community of practice through WeChat. So I think this WeChat is similar to WhatsApp, something like that. So that's intentionally developed to support teacher professional learning. And from their study, they see that there are several elements of online COP. First, of course, is the content. So it's the same of what we are discussing previously about the elements of COP. Is about the content. What are we discussing? What are the knowledge that we want to share and so forth? And of course, the next component is the conversation, the online discussion. This is very important in online COP. How can we discuss through online mode? We have to understand, I think, that some people may not be quite comfortable to talk online, to discuss things online. So when we have an online COP, we have to ensure that everybody can pitch in, can be comfortable enough to share their ideas and knowledge through the online mode of communication. So it is important to ensure not only the content, but the conversation that is going on in the COP by making sure that everyone is comfortable enough to discuss through online. And of course, connection, the interrelationships, the connection and trust between all the members of the COP is still very important in an online setting. And of course, the context, the practice, similar with the practice, the relevance of information and application on each member's own situation. So basically, the concept of online COP is the same, but of course, there are technological issues that are involved. The online conversation, the online discussion perhaps require a different approach, but of course, different technological support, and to ensure that everybody is willing to share their opinion online, they are comfortable in using the technology and minimize any barriers of communicating and conversing through the online discussion, online mode of communication. So this is a very interesting article which I came across about implementation of virtual COP for family physician training. So basically in this article, the authors created a virtual COP for family physicians in training in Australia. So geographically, Australia is quite, is very large, and some practitioners are in many different practitioners in different areas where they can feel isolated and maybe far from the main center of education and so forth. So the virtual community of practice is developed to allow the family physicians all over Australia to develop, to improve, to share knowledge, to share experience, and so forth. So if we look at this virtual COP that the authors develop, we can try to match it to the elements of COP. First is the domain. So there are what is the domain of this COP? This domain of COP is particularly the domain of medical knowledge for the family physician. So the COP involves family physician, and the domain is the family medicine. So that's the domain. And what is the community? The community, of course, the family physician, the practitioners of family medicine, who are in the COP and with differing level of expertise. So this is related to what I've mentioned before, the importance to have different people with different level of expertise in the COP. And then the shared practice, the practice element is the shared practice of medicine to which the knowledge will be applied. So this particular virtual COP has fulfilled all the elements of COP. There's the domain, which is the medical knowledge. There's the community, which is the practitioners of family medicine with differing level of expertise. And the practice is the practice of medicine, which will be applied into their own setting wherever they are. So from this study, the authors have concluded several lessons learned, which I think is very important to be shared with all of you. First is knowledge sharing is most effective when there is knowledge gradient. That's why it is important to have people with a differing level of expertise so that there will be knowledge gradient and then there will be knowledge sharing based on the authors of this study. And trust can be built between participants through online. So this is very important because we do it online. Of course, we have to ascertain that the trust is already there, and perhaps the facilitator of the COP at the first time needs to ensure that trust is already there and everybody is comfortable with everyone. The COP in this study is specifically designed to overcome isolation and improve connectedness because of the geographical challenge in this particular part of the world. So they feel that the GP, the family physician, needs to be connected, and the virtual COP successful in overcoming isolation of family physicians in the study and improve connectedness amongst them. And of course, because this is a virtual COP, details related to the technology used are very important. This is one of the factors that ensure the success of the virtual COP. And based on their study, they list steps to implement online COP. First is a facilitation. Who's the facilitator and how good they are at facilitating the COP is like the number one step, the very important step. But also the champion and support. Who will be the champion and what kind of support that these community of practice will have, that's also important. And of course, related to the elements of COP, we need to have clear objectives and goals, because clear objectives will lead to motivation and everyone in the group will feel responsible to contribute to the group to achieve a common and clear objectives. The author mentioned about broad church, which means that the COP should involve different experts or different groups. Perhaps if we talk about COP in this case, a COP for family physician, perhaps the member of the COP doesn't need to be all of them are family physicians, because we can then perhaps involve the allied health, for example, as members of the COP, but be careful to not make it too broad. So it is about finding the balance of who will be included in the COP. Perhaps different people with different background of expertise, but not too broad. Supportive environment is very important. So a safe and encouraging environment is very important for the COP to work, based on the author's reflection on the process of creating virtual COP for family physicians. Of course, benchmarking and feedback. So the facilitators should regularly ask for feedback from the participants, and also vice versa, feedback from the facilitators to the participants, to ensure that everyone's involved, to make sure everyone's learning something and can contribute to the COP. And of course, the seventh step is very important: technology and community, the ease of use and access to different modes of communication. So for example, if we want to create an online HPE COP in our country, what will be the mode of communication that we're going to use? For example, we use WhatsApp group. We decided to use WhatsApp group. How reliable is the WhatsApp group? How can we maintain the WhatsApp group to be safe, to be enjoyable for everyone to share their opinion? So that would be the one thing that we need to think about. And if we use other mode, for example, who's going to maintain the information? Who's going to make sure that the technology is still on for us to contribute something? So if we look at the steps, now we look at the challenges in establishing online COP. I guess the notion of time is the challenge in everything, including in offline COP and also online COP. making sure that everybody has the time to contribute, making sure the facilitator is diligent enough to initiate discussion, to involve everyone. That would be the biggest challenge of time. Are we going to have time to maintain the COP in the midst of our other tasks and responsibility in the faculty or in the hospital or in other setting? Particularly in online COP, we need to be familiar with the technology. So perhaps at the beginning of the COP establishment, we need to have some training for all the members to be familiar with the technology so they can make use of it optimally. And another challenge is the policies and strategies to promote online COP, including reward system. So this is very important, as I've mentioned before. How can we recognize and reward participants based on their participation in the COP? And perhaps just like when we recognize teachers when they involve in the formal faculty development program, how can we reward them when they involve in the COP in a way that is important to promote the online COP. Identify experts. This could be the challenge. Whose expert are we going to invite into the COP to become the expert in which everybody could to whom everybody could learn. Of course, this could be difficult because we may not know who's the expert, and if informally who's going to be the expert. Maybe it's not enough just to know that this person is an expert, because maybe that could be easily seen in the internet, where we can put somebody's name and then we can see who's what are the expertise of that person. But whether that person could be the person who can nurture everyone in the COP, open-minded, willing to discuss and argue and so forth. So that could be another challenge. And the last challenge would be ensuring the perceived usefulness of COP. So as everything, when we don't find something useful, we don't really motivated to work on it. So when we ask somebody when we ask a group of people to develop COP, we have to ensure that they believe and they feel the use of COP in order for them to be motivated and contribute to the COP. So I like this quote in this particular article about COP. COP is when masters and apprentices sharing the practice of medicine, whereby apprentices are helped to understand the finer details inherent in the administrative side of medicine in a busy clinical practice. So maybe this is specifically for medicine, but I believe that this principle can be applied as well to another context. For example, the HPE group, where we have in the HPE group those who are the masters and those who are apprentices, and they can learn together. The apprentices can learn about the finer details that inherent in the administrative side of teaching. So that could perhaps this principle could be applied to any other context of COP. So when we look at the tips for implementing COP for faculty development, we see that one tip is to go online. So I think in the current development of the world, where everything is digitized, everything is about technology and how the technology has really influenced and shaped our life, our working and personal life. So it's very important for us to make sure that our COP is also online to some extent, because there are some benefits of online COP. First, there could be continuous discussion and interaction, because the nature of online is to make it borderless. So we can have continuous discussion and interaction. And the good thing about online COP is that we can also track the activities through the report and content. And we can have online repository where everything is documented, everything is recorded, whatever people saying, it's already there. It can be kept, it can be recorded, and we can have online repository in which we can access them later. So the good thing about online is that we're going to have repository of what we are discussing and what we have been producing in our COP. And of course, when doing this online, it will be easier for us to disseminate our COP success, because communicating success is also one of the important steps of establishing a COP. So before I close my presentation with several take-home messages, can I ask you to go to the Menti again, but this is a different code. So yeah, let me stop share at first, and then I will post the link to the chat room again. Thank you for your patience. Yeah, that's the link. If you may, you can type in the code. Hold on, I will share the code again. A different code. So this is the code 316903. So you can go to the link that I've shared in the chat room and then type in the code. And then the question is, what do you think is the most significant factor influencing the establishment of a COP, whether it is face-to-face or online? Although I think whatever COP that we are establishing now, it will have some online components to some extent. So you can type it. Let me share the results with you. Please bear with me for a minute. I will open the Mentimeter to show you the results. Yeah, thank you very much. I think we have quite a number of interesting response here. Okay, so what is the most significant factor? Face-to-face, interesting. So maybe we cannot have full online COP, maybe, but still need to have a certain amount of face-to-face interaction and meeting. Thank you very much. Commitment of everyone. Intellectual participation is very important. When we go online, sometimes we can be, it's easy for us to share everything, what we think of something, and because it is continuous, there's no boundaries of time and space. We could be easily talking about something not related to our purpose, and we don't participate intellectually into the group. Thank you very much. Scope for sustenance, shared domain. Thank you. The goal of the COP and the facilitation, very important. So when we want to create a COP, we don't just make random group, but we need to decide who's going to be the facilitator. And this facilitator needs to be experienced maybe, or trained or skillful in facilitating the group. Attitude and readiness, open-mindedness, common goal. Thank you very much. Open-mindedness is very important because we want to learn from each other. Therefore, we need to be open-minded to everything. Composition and personalities of the members. Interesting personality. Based on my reading, I don't really find personality, but because we involve individuals in the group, I think personalities is also can be both a challenge or the significant factor, but that could be maybe overcome with a skillful facilitator who can facilitate and lead the COP. Face-to-face occur again. So maybe, as I've mentioned before, we still need to have a face-to-face COP to some extent. Thank you very much. I will move on to my last slide about the take-home message. I'm sorry, sorry for this technical delay. Okay, I think, yeah. So this is my last slide as a summary of what I've been sharing with you almost in 1 hour. So the COP can be intentionally created as a part of faculty development program. So when we are in the health professions education setting, we can intentionally create the COP as a part of faculty development program. But if we are in the hospital setting, in the healthcare setting, we can also create COP for certain certain projects or certain goals that related to the work or the practice of medicine in the hospital setting, for example. So it can be intentionally created. To achieve an effective COP, the domain, community, and practice needs to be established along with the participation and engagement. And we cannot deny that the role of facilitators and champion play important roles in ensuring the success of COP. When we intentionally create the COP, we also select the right facilitators. We put the champions there to keep the COP going, because we can easily be distracted because we have other tasks and other responsibility. So we forget about the COP, we don't do anything about it. So they're very important, the role of champion and facilitators. Online COP, of course, allows for borderless interaction and knowledge sharing. So within this current situation is very important. And I believe even when the pandemic is over, the online COP still very important to allow borderless interaction. But of course, maybe the face-to-face to some extent is also important, as one of the participants mentioned in the Menti just now. Time is one of the challenges in COP, as I've discussed before. And of course, in an online COP, technological issues are also very important. So we have to be sure that all participants are ready and comfortable to use the technology to ensure the success of COP, because the success of COP heavily depends on the participation of each member of the COP. With that, I would like to close the presentation. Thank you very much, ladies and gentlemen, for your active participation in filling out the Mentimeter, and also for asking questions maybe after this. Thank you very much. With that, I would like to hand it back over to Prof. Kosala.
Sorry. Thank you very much, Diantha, and for that enlightening presentation on communities of practice. And I think all of us are convinced that it's something doable within our reach, and something we should do. I agree, face-to-face is good, but also nowadays with this social distancing online, and also I should say I really enjoy the online WhatsApp groups that I have. On various, again, the goals are different of those groups, but so that gave us a lot of experience on this, and we can definitely develop it and move forward. And not only for medicine, I think even for university administration and anything it applies. So with that, and may I invite any questions, because I did not see except one question from Sisira. I did not see that many questions in the chat box. So if anybody's, the Sisira's question is, shall I read that for you, Diantha?
I can directly
you
answer.
can see it, right?
Yes, I can see
you?
it.
Okay.
Yes. Thank you.
Thank you.
I will try to answer the questions from Dr. Sisira. Thank you very much. So it is about reification. Does it involve clinical practice? For example, a group of specialists who engage in clinical practice and training within a given specialty. So I think in general, the concept of COP applies to every aspect of life and work, I guess. I think so. If we talk about specialty training, residency training, for example, COP also applies to that particular setting, where a group of doctors learning together how to become specialists, how to become a consultant in their own expertise. So that could also account to as a COP. Medicine is also a COP. So I guess also postgraduate medical education is also a COP. Because if we look at the attributes of COP, for example, the reification, where they produce artifacts, in the group of specialists, or maybe in the group there are also the residents and so forth, they can get together and develop certain values that they want to share to everyone in the group, and certain beliefs or certain practice that applies only into that group. So I think it's very, very relevant. Thank you very much. So the second question, how far the concept of COP applicable in undergraduate medical education? So I think for the students, because if you look at the articles about professional identity formation, it is also important to help students to to take part in their professional identity formation, and to realize that when they are in medical schools, learning in medical schools, they also in the process of establishing or developing their professional identity formation. And that's where the facilitators perhaps in the medical students, the facilitator could be the senior students. Perhaps they can develop, I'm sure, for example, in my medical schools, the students, they form a group, and then the group will also involve the senior. So the senior will then become the sort of like the facilitator to help the medical students, the younger ones, the junior, to be accustomed to the practices in medical school. So eventually they gradually develop their identity as a medical student from starting to enter, just start to enter, and then gradually develop their professional identity. So I think it's very, very much applicable in relation to the professional identity development of medical students, because we say that when somebody has the right identity, they are more committed to the work. So we expect students to develop professional identity as medical student to be able to perform optimally as medical student. Thank you very much, Dr. Sisira. So maybe the next question will be from Dr. Chandana. Can we accept whole faculty as a COP with our one goal and all elements described? Yes, very interesting. So can we ensure that can we take the whole medical school as a COP? I think if we should answer that, we can look at the attributes and the elements of COP. The domain perhaps are there, but whether there are interactions and trusted relationships among all faculty. If there are relationships, there are sharing knowledge and sharing practices, and there are common goal that we want to pursue, I think that considered as COP. So maybe the question is whether, how can we differentiate just a random group with a COP? I think it goes back to the elements, whether there are trusted relationships, and who is the facilitator in that group, who's going to be the facilitator of that group, and what are the practices, what are the artifacts that are produced by the COP of one faculty of medicine. So maybe a COP as in faculty of medicine will be too broad, because the practice maybe not so clear of what are the COP, that what are the things that are produced by the COP. But perhaps in the department or in a smaller group, for example, in a clinical skills laboratory. In our clinical skills laboratory, there are members of staff from different departments, and they gather in the clinical skills laboratory and create a community of practice in the clinical skills lab to discuss about how can we make the teaching more effective, how can we create our own simulation models. So I think the goal needs to be quite as specific as possible. Otherwise, it will be difficult, I think, to manage the COP if you have too broad goals. So maybe if we talk about COP in the Faculty of Medicine in the School of Medicine or Health Professions, we can have it more into some specific aspects. For example, in the basic science, in the clinical setting, in the clinical skills lab, or in the biomedicine department, and so forth. That will be more manageable, I think. Thank you very much, Dr. Chandana. Dr. Sifan, are there tailor-made platforms, software to create academic COP? Very interesting question. The article that I've shown you in the slide previously in the Australian virtual COP use a particular platform. So maybe you can check through the article, because I'm not really familiar with the particular platform as well. But I think there are numbers of there are many platforms, online platforms now. We can choose which one is the most suitable for us. And maybe we can check on the article that I've shared with you to learn more about the platform. So because I'm sorry, I'm not really good at technology. So I avoid of explaining technology because I'm not really good at it. So perhaps that article could be helpful, Dr. Sifan. Thank you very much. So maybe this is the Yeah, so the next one from Dr. Shalika. What are the global COPs which are open for medical educators through social media? Thank you very much. So if we, in social media, we have a number of organizations post their, have some social medias in which everyone could see whether what are the information from the particular association. Although I'm not convinced whether that could be regarded as a COP because I'm not sure whether there's an interaction. So in the global COP, I'm not really sure that I have the answer. But if we look at some organizations of medical education, they have social media and they post and share information there. So that could be the start. But we have to see whether there are interaction within it. But if we look at organization in which we are the members of that organization, that could be regarded as a COP as well, because there are interactions within the members. So maybe we have more spontaneously created COP than intentionally developed COP, I think. For as Prof. Kosala mentioned, she enjoyed the discussion through WhatsApp group. I think that's the spontaneously created. Some people with certain interests, with the same interest to about something in medical education, they then create a group and they share information there. So I guess we could start our own COP at the first, because we know what we need. We understand what we need and we can work on that need. So because if we join the global COP, maybe the objective would be too broad and it doesn't really, maybe not really relevant to what our needs now. So make sure that when you join a COP, you understand what are their goals and you align it with your own goals. I think that's about it. Thank you very much, Dr. Shalika. I hope I can answer some of it, not all perhaps, but thank you very much.
Yeah. Thank you very much, Dianta. I think time is up and it was a very interesting discussion. And the questions were also very, very pertinent and interesting. So over to you, Rizka, for the final, I think, comments and vote of thanks. Thank you very much, Dianta, for your support. Yeah.
Yes, thank you, Madam. So this brings us to the end of a very successful session as well as a series of international webinars. So on behalf of the College of Medical Educationists and the organizing committee of the Colombo Conference on Medical Education 2021, I would like to express my gratitude to Dr. Dianta for her volunteer participation and sharing her expertise through a very engaging session. And of course, our moderator for today, the President of the College of Medical Educationists, Professor Kosala Marave. I would also take this opportunity to thank our team who work behind the scenes tirelessly to make all this possible. Dr. Pandula and Dr. Chamika, thank you very much. And let me give you a little brief idea of what we have lined up for you. So we have an array of regional workshops organized by some of our key universities, such as the University of Colombo, Kalaniya, Jayawardhanapura, and Jaffna, commencing on the 8th of November. The main conference is scheduled on 19th and 20th November, followed by a post-conference webinar on the 25th. So for further details, kindly visit our website, colombocme.org, or the College of Medical Education's Facebook page. We've got an interesting lineup of events for you. We really hope to see all of you at the main conference. Thank you and have a good day.